Stand by. You're live.
Hi, everybody. This is our Friday virtual support lives brought to you by the Rainbow Support Group. We are the Rainbow Support Group SC based out of Spartanburg, South Carolina. You can find us at www.rainbowsupportgroupsc.com. And we also have 3 Facebook pages. We've got our Facebook group, which is private, which you have to ask permission for. We've got our Facebook page, and we also have our new Charleston chapter page. You can locate us on there. You can find all of our board members' contacts on there as well. And we look forward to hearing from you guys. Tonight, we have a wonderful guest from Piedmont Care, one of our partners in the upstate. And we wanted to bring some really important information as part of Condoms with Kim. Normally on our meetings every month, we do a segment called Condoms with Kim, and we talk about information that we learned from Piedmont Care. During the quarantine, things got weird, and we called him, and I said, "LOREE, is there anything that we can do?" I saw that Pride Link did a live with Aid Upstate in that direction of where we live, and they provided some great information. So I called LOREE and I asked her if she'd do the same for us. David, our wonderful communications director, is there anything you wanted to add?
I just want to say, we are so thankful to have you here with us, LOREE, and I am so grateful for everyone that is tuning in already to join us. This is super important information. We've been working on this broadcast for a few weeks now because we genuinely felt that this is life and death information that we are sharing with you guys tonight. So we are so glad that all of you are here. And if you do have any questions or comments for LOREE and Piedmont Care, please put them in the live stream comments, and we will be sure to address those tonight.
Exactly. And remember, too, for those of you, and we'll say this again in the live, most of the people who watch our lives watch it after we're already done. So if you have questions, message us or message Piedmont Care. We'll have their links on here, and message them directly with any questions you might have. Please don't think because we're not on air anymore, you can't ask questions. Education is key. The Rainbow we are fundamentally going to continue with educating the public. If you need any resources, please reach out and let us know. If you can't get a hold of Piedmont Care, let us know and we'll put you in touch with Piedmont Care, okay? Because we're partners and we all work together. So LOREE, Miss LOREE Bishop, tell us about you. Tell us about you and Piedmont Care.
Well, thank you for inviting me. I love an opportunity to educate wherever I can, especially for people who most need it. And so I am the prevention coordinator for Piedmont Care. Piedmont Care is an AIDS service organization, a nonprofit based in Spartanburg, South Carolina, but we do serve Cherokee and Union counties as well. So one of the things that we do is we provide case management to people living with HIV and AIDS, but I'm here to talk more about the prevention side of things. So we do free HIV testing, we have free condoms, free barriers. We can do any type of education in normal times. I usually go out to actual sites and I do education to groups. We can, and also in normal times, bring HIV testing to your site. But I just am really glad to be here because I want to talk a little bit more about what we do in terms of prevention and why that's important.
Cool. And at Piedmont Care, what services specifically do you offer there?
Specifically, we offer the free HIV testing. So we prefer for you to have an appointment, but we can take walk-ins just as available. We give free condoms. We always have them available. We have them available in the lobby: condoms, lube, dental dams, internal condoms, flavored lube, flavored condoms, just the whole thing. Currently, the office is closed to visitors due to the pandemic and due to the virus, but we still want for people to have access to the free condoms and barriers. Therefore, we have put them on a table outside of the office. And I got that idea from Palmetto Community Care. I can't take credit for that idea. But we put them on a table outside of the office. The office is at 101 North Pine Street in Spartanburg. It it is inside the Wells Fargo building. So when I say outside the office, I mean inside the Wells Fargo building. And on that note, our location is important, and I like to talk to people about that. Given the services that we provide, case management for people living with HIV and AIDS, and also people coming in for HIV testing or for condoms, the location where we're at is very, very discreet. When you enter that building, if you're not familiar with the building, it's just a very large bank building. It says Wells Fargo on it, and there are a ton of other businesses that are housed under that roof. So when people come in and you are worried, that someone may see you, that you're meeting with your case manager and you don't want for someone to know you're HIV positive, or you're going in for HIV testing, or you're going in to get a bag of condoms, everything that we do is with your privacy in mind. So again, it's just a very discreet location. You can be entering that building. If someone sees you, then if that's an issue, just say, hey, yeah, I had to swing by the bank. I had to go talk to, whoever was in there. So yeah, that I really like to talk about our location because I think that's important.
I think it's funny too. It's not funny. I hate the word funny because it's not the right word. But if you don't know about the LGBT, you just don't know how paranoid a group of people can be. Okay.
True.
When it
And
comes
I
to
think a lot
medical
of
care,
people, yeah,
for you to know that I love you so much. For you to know, in order for my people to get out of their car and go in that building, they got to know. And you
yeah,
just did the whole thing. And I want you guys to know that she's right, because I've been there, because we've had class there with LOREE. When you go in, it's an empty hallway, and there's the elevators. And you take the elevator to your floor, and Piedmont Care is on the floor with other businesses, like 3 or 4, not very many at all. And then they're right there at the hall. Like when you walk down the hall, boom, there it is, and you go in the door. So yes, LOREE, how cool. See, I love you. Thank you for caring. Thank you for caring, because we do care about that, and we won't
we
get out of the
do.
car. Like
Yeah,
if you had to walk through the bank, like through the tellers, they wouldn't go. They
right.
need to know that it's a hallway to the elevators. It is nothing. It is real quiet. And the parking lot is actually around the back. So even though you're downtown, you drive around the back of that building and it's all really quiet in that parking lot.
Mm-hmm.
I mean, it's a nice, secure place. So
Yeah,
yeah, thanks for bringing that up. See, you're so cool.
of
You're so
course.
cool. A lot of people don't think of that, about that. And Mocha and I
Right.
have been invited by doctors and therapists to talk about how can they get more LGBT people to come to them. And I said, well, first of all, you have to understand they're just paranoid as hell. So they have to know it's safe, like telling them to put little rainbow stickers on the door or in the bathroom or something like that to give them a key that it's okay here. So I like how you did
Yeah,
that.
it's a lot of different layers to that. So that's just one component of things that we do to make folks feel a little more comfortable.
Super important. Okay, what do you want the rainbow to know about Piedmont Care and what they can do? What do you want us to know?
I want for them to know that even if there is some sort of medical mistrust, or if there is just some underlying anxiety, if you're concerned about the way you are going to be treated, or if you're worried about that someone may judge you or anything of that nature, we do not want anyone to feel that way at all. We have a very affirming, very welcoming environment, a very discreet environment, as we have
You
already
do.
discussed. Yeah.
You
Um,
do.
and I think that just the nature of HIV and AIDS and who it impacts, we are painfully aware that it disproportionately impacts LGBTQ plus. To that point, we have to know the reasons why, and we have to know what's pushing that. So just taking a step back and looking at that from a big picture and what we can do to make a person feel more comfortable. We want to not just, our point is, or our mission rather, excuse me, is not just to lower infection rates. I mean, we want to help you. We want to get you into treatment. We want the lower infection rates, but we want for you to feel comfortable, and we want for you to be able to come in and feel like you are welcome and you have someone to talk to, and that we are well versed in anything that you may have to say. I told you, Kim, back when you guys came in December, and now I have completed it, but I am a University of Michigan trained sexual health educator. So I am,
Nice.
yeah, I just finished
Congratulations.
that. And I tell people, I tell my testing clients all the time, no matter what your situation is, if you're in a polyamorous relationship, if you have come in after, a quickie, after a one night stand, whatever the case is. I mean, we're all sexual beings. And I just want to, tell you that you've made the right decision, because it does take an incredible amount of courage and bravery for someone to come in and get tested for HIV regardless. But any of your situations that you want to discuss with me, I am qualified to discuss those with you, and I will do that in a non-judgmental way and an affirming way. And I just want for people to feel welcome.
And you've done that since we met you day one, and we didn't know you were going to go and be all important and get a class and all that. However, that's what we picked up on when we met you, and we had a conversation when we left on the rainbow people. They're just real nervous people, and if they don't trust you, they're not going to come to you. They're not going to ask you things. They're not going to question. They're going to sit on it. Okay, they are. When we met you and we found out how cool you were, and you were so open, and there was no judgment. Okay, no matter what we said or the questions that we brought up, you did not even flinch. I'm like, nah, she good. If she can handle our questions, then she's good, because we're the rainbow, and we don't stick them in a little box. They're big box. So what do you have to say to my trans brothers and sisters about what Piedmont Care can do for them specifically?
I think that there's a certain there's some buzzwords that I think that people throw around a lot. And I do want to address those as far as our environment. So when you say specifically trans folks coming in and you hear cultural competence, I think that Piedmont Care tries to steer more towards cultural humility, because cultural competence is, in my opinion, it insinuates that you know everything that there is to know about a person, about a topic, about an issue. And we are more gearing towards cultural humility. And what I mean by that is we do our best, we stay educated, we are constantly looking at the webinars and the trainings and everything that I learn, and all the stuff that I brought back from school. It was my responsibility to share that and to educate the staff members so that we can just treat people with the respect that they deserve. So in that vein, cultural humility, if there's something that we have done wrong, that we have done that doesn't sit right with you, something that is not the way you like to see things done, then we are open to suggestion. We're open to learning. We're open to finding out whatever we need to do to make people feel welcome and affirmed.
Right. Communication, not confrontation.
Nice.
Yes,
I love that.
Nice. Me too. I live by that. I live by that. I don't ever say I know everything. And I always want to hear it from other people's point of view. Like, tell me your story. Like, I really want to know, because in order for me to understand or even try to understand, I got to know your story, not my story, your story. Mm-hmm. So yeah, that conversation, and you are aware. I know this is a redundant question, but because you're so cool and hip like that, you are aware of the different issues facing our trans community versus the LGB as a whole. Are you aware that there is a big difference between the issues that they're having right now?
I am. I'm so sorry, Kim, you cut out for just one moment, but I did hear you. I am. I know that I keep saying this, but I know that the medical mistrust is, I know that that's underlying in, across the board, but especially for our trans friends. And I actually saw an article recently about trans folks being unwilling to seek medical care if they had symptoms of COVID. And I know people have made a lot of comparisons or parallels between HIV and COVID-19, but I think that there are some of these things that are being brought forth that we're seeing that people don't realize. So I don't think, if a quote unquote layperson who's not me, who's not working in HIV, or who is not you, who is not, over the rainbow. That sounded funny, but you know what I mean?
We are over the rainbow, though, aren't we?
You're
Right?
over the rainbow.
You're so funny. We love Lori.
But I think that if a person, they may see that article and say, well, why wouldn't a trans person want to go and seek care? Wouldn't they want to get better? Wouldn't they want to get healthy? We don't know that, that person has gone into a doctor's an office or a building or something like that. We don't know how people have reacted to them. We don't know if people have asked pronouns. We don't know if people know, the difference between a cisgender person walking into a doctor's office versus a trans person walking into a doctor's office. If you are LGBTQ and you're cisgender, then you can almost, like, I guess, to a doctor's office, fly under the radar. If you're a trans person, then that's going to maybe make you feel a little more self-conscious, or it's going to make you a little more hesitant to seek care, because so many people from front desk staff,
so much happens in a doctor's office. I mean,
right.
One just happened just the other day, and my heart broke. I wish I had been there. So, dude has to go to the doctor because of female problems.
Mm-hmm.
Serious female problems. Okay, so now has already been to the hospital and now is going to the doctor's office as requested because it's so bad. But I'm a dude, okay?
Mm-hmm.
So goes into the doctor's office, tells the doctor that they're there for their appointment, and the woman says, you don't have an appointment. And he says, but I do have an appointment. And now remember, I didn't want to go to the doctor anyway. Now I'm freaking, right?
Yeah.
So now I want to leave. So now I'm like, okay, what do I do? What do I do? And I said, okay, tell them again, explain to them who you are and that, yes, you do have an appointment there. Goes back and tells them, has to give them social security number and driver's license. And at that point, the person says, oh, you do have an appointment. Okay, that is like one of nothing problems. They have problems just going to the doctor.
Yeah.
So yes, the trans people have to know that you're familiar with trans, you know their issues, you know how to address them. I told that person on the phone, make sure you tell that doctor's office, because now I'm mad, right? So when they get to the back, she said, but Kim, just to let you know, your the nurses in the back are being really nice. I said, well, make sure they know what happened up front so that doesn't happen to the next person. And he said, I'm already on it. I'm already on it. Okay, so they needed to know that. Hey, David, I see you're saying my camera's blurry. I wouldn't know how to fix that because I haven't touched it. So I don't know how to fix that. But yes, you're right. Trans have huge issues. They have issues just going into a doctor. So the rainbows were.
And also, and I don't mean to get too in the weeds here, because we don't, we don't provide care for people. I mean, when I say care, like a clinical office, like a doctor's office.
Correct.
But just to further to that point that we were discussing, doctors need to be not only welcoming, but they need to be knowledgeable about trans issues. So if you have your trans woman is still going to need maybe to get, a prostate check. Or if you have a trans man, then that person maybe, needs to get still the mammograms and things like that. So they need to be knowledgeable as well.
And we need to know that, like we talk about, the trans people also end up in surgeries and things like that are important. And we need to know that our doctor knows what the hell he's doing.
Oh, for sure.
And that,
yeah.
This isn't just a pill you're giving me, and it's usually injections or it's whatever, and it's surgeries. And we want to know that you know what you're talking about. Like, I've heard so many trans people say, I can't believe I had to tell my doctor about this. Like, can you imagine being in your little robe in the doctor's office, having to tell him, by the way, doc, this is how this works. Okay. It'd be all like really weird. So yeah. they got to
Having
know.
to educate your doctor, yeah, that's going to be, I mean, we just keep laying on the issues, but I mean, I think this is an
I
important
know, right?
conversation to have because it keeps we're just repeatedly highlighting more and more issues that our friends are facing.
But I think it's lovely, this conversation. I like it. I know the pandemic's horrible. The pandemic has done a lot of good things for education, however, and I know that the Rainbow every
Mhm.
Friday has been providing the best information. Now, I know in the Rainbow we talk about this stuff, but you don't hear it out in public. You don't hear people discussing this stuff because it's all on the down low. Okay, well, I love it that we're able to put this stuff out here. Okay, like we're going to get into some stuff right now. Now they know how to get to you. They know where the resources are available. I have talked about Piedmont Care Forever, y'all, and their little waiting room. Candy dishes full of condoms. Okay, I'm talking full of condoms. You can have whatever flavor, whatever kind you want. And like I
Mhm.
told you guys before, they're really nice ladies. If you wanted to go up there and grab some and just say hi, do that. I mean, they're really doing great for our community. But now let's talk about the deep and dirty. Let's talk
Okay.
about HIV and STIs. Let's talk
Okay.
about that, especially during a pandemic. Okay, we normally talk about this stuff. We do condoms with Kim all the time. Everybody knows about my map. Everybody knows about my map that I got from LOREE
Yes.
months and months ago. Okay, carry this thing around with me everywhere. The reason this map shows you, and we are the highest rate of STDs, highest rate of AIDS, highest rate of pregnancies, right there. Why? Lack of education.
Southeast. Yep.
Lack of education. So the Rainbow Support Group and Piedmont Care work really hard, and I know Upstate is working real hard to educate people so that we don't have these rates going high. And just like she said, we want people to know that Piedmont Care is out there for you, not just for testing and to reduce, but we do want to reduce. We want to take care of those people that have it. So if they're not tested and they don't know, there's facilities out there for you that can help you, and Piedmont Care is one of them. So
Mhm.
this is great. So let's talk about it. What are we
Okay.
going to talk about? What do you think the basic knowledge of HIV? What do you think we should know? Just the least that we should know.
The least that I like for people to know kind of sounds like for some people an insult to intelligence, but I want to talk to people about you cannot get it through casual contact. You cannot get it from surfaces. You cannot get it from a toilet seat, from a water fountain. And the reason that I stress that is because part of what we do when we're educating is we are reducing stigma. And I think that at a time, people were much more aware of how HIV was spread. And then I think that with the new medications that came out, it's not so much in the forefront of people's minds. So now I think that there's a generation where that knowledge is lacking. So HIV is going to be most commonly spread through sexual transmission. It's going to be also spread through IV drug use, and in very rare cases, it can be contracted or perinatal transmission, so a mother can pass it to her child. I would like to stress that it is possible for an HIV positive female to give birth to a child that is negative. She would just have to make sure that she were in care and following doctor's advice. I started talking and rambling, and I don't remember the question. What did
Okay,
I want
so
people
we
to
were
know about
talking about, okay,
HIV?
yeah, yeah.
Yeah, so I guess maybe that most importantly, it's not spread through casual contact. CDC statement says that latex condoms, when used consistently and correctly, are highly effective in preventing the spread of HIV and other STIs. If you can't use a latex condom, there's always non-latex condoms, or you could use an internal condom, which are made of nitrile. So those would be an option for folks that have a latex allergy or sensitivity. I just employ your safer sex practices. PrEP may be an option for some people, and there are ways that you can get. I think that there's a misconception. Well, it's not a misconception. It is very expensive, but there are programs out there to assist people who are interested in getting on PrEP.
So you talked about who's most at risk. What about STIs?
For your STIs, I think it's important to remember, I didn't understand this before I started working at Piedmont Care, but I'd like to take some time to explain it here, that having an existing STI is going to put you at a greater risk for acquiring HIV. And the reason for that is HIV is looking for a portal. HIV is looking for an opening. So if you have genital warts, if you have herpes, if you're having an outbreak, if you have a syphilis sore, then that's an additional portal through which HIV could enter. If you have inflammation from chlamydia or gonorrhea or anything like that, that's going to cause an increase in white blood cells and the T cells, and that's specifically what HIV attacks. So that's why it's important, and that's why the two are intertwined. You want to make sure that you're not just getting tested for HIV, you also want to get tested for STIs. And a lot of times your STIs can be asymptomatic. So you still want to get tested for them just to ensure, because that's going to, again, put you at a greater risk for getting HIV if you have an STI.
And that hit that same point again that I've already brought to our lives that you taught me the last time when I went to you to get more information, was that whoever's in charge of all this testing stuff says that everybody between the age of 13 and 64 should be tested.
Mm-hmm.
Okay, that means everybody. Right, but people don't think, well, that I don't need to be tested. I'm straight. I don't need to be tested. I'm whatever. And I'm like, no, you don't get it. Everybody needs to be tested because of the environment in which we've all been in.
True.
Now, you can't tell me you didn't have sex with somebody and you didn't really know everything about them. I mean, you don't know if they had something. And like you said, I could be asymptomatic. I just might not ever show symptoms, but I could plainly have it and not know. Everyone needs to be tested. And I think that the services you guys provide and how easy you make it. Now, my question is, normally it's super easy to go see you guys. I just go into your little office building. I go check you girls out. I do my little testing and I go home. Mm-hmm. But now with COVID, what do we do now with COVID?
So
how are they going to get tested now?
Yeah, the approach we're taking, that's thrown a wrench into absolutely everything, but the approach that we're taking, we're having people contact the office, and whether that's through phone call or if you want to email me or, anything like that, just let me know your name and a good number for you. And I'm keeping a spreadsheet of people that when we reinstate testing with enhanced safety protocols, I'm giving those folks who have contacted me priority. So I'm going to try very, very hard to get all those people in and get them tested. And we're just going to hit the ground running as soon as we reinstate testing. Another thing I would like to mention about privacy and being discreet, if you do call and leave a phone number and I call you back because I want to schedule your appointment, it will say unknown or private call or something like that, because we want to, that's just another layer of protection of people's privacy.
I love that. Mm-hmm. I love that. Confidentiality is key, man. We got to
Yes.
do it on the down low. Got to do it on the down low. Okay. When testing is done, tell us about the process of the testing itself when it is done.
Okay. So the test that we provide is an oral swab test, and we do some education with it. So we call the whole process HIV testing and counseling. So not counseling as in, I'm going for mental health, but counseling as in, let me, the tester, the testing counselor, talk to you about what brings you in today. What are your risk factors? What type of sex are you having? Who are you having sex with? And that seems very, very personal and very, very prying for some people. But I like to prep people for that because I want for them to be prepared that we are going to ask them these questions. And the reason that we're asking is so that we can determine risk factors and that we can make appropriate recommendations for you. So we're going to steer you in the right direction if you want to get on PrEP. We're going to talk to you about, do you use condoms? Why or why not? We're going to talk to you about condom negotiation, all of those things. So again, I did get a little off on a tangent there. I apologize, but it is.
I told you we're the rainbow. It's all right. We totally allow that. Totally.
It's an oral swab test. You get results in 20 minutes. If we have a preliminary positive with the oral swab test, we are able to do the confirmatory, which is the finger stick test in the office. That particular test takes 10 minutes. In the event that someone tests positive for HIV in our office, we immediately connect that person with a case manager, and you automatically are connected to someone and get some questions answered. And we like for the person to meet with their case manager that day if time allows, if their schedule allows, because when a person hears that they're HIV positive, I know from experience that they're not hearing anything else that I'm saying to them. They're not hearing, this is not a death sentence. They're not hearing undetectable. We can get you to undetectable. They're not hearing any of those things. It's just such a shock. So I think that it's good for a person to meet with their case manager. And I always tell people, if you leave and you have questions, please contact me, because that is a huge thing to process and to be hit with. So that's how the process works. Oral swab test, finger stick only if you have a preliminary positive with the oral swab. I would like to mention that the oral swab test is going to detect the presence of HIV antibodies that would be produced by your body in response to infection. So saliva, none of that does not transmit HIV, because it does not contain HIV, but rather the antibodies that fight against the virus.
Now, you and I have talked about before that the people that hear this, like I called you one time and I said, okay, I need your opinion on self-testing. What is your opinion? And I love you. And you said, it's fine. And it's, you can do that, but we don't recommend that, because if somebody gets a positive test, we want to be there for them. Yes. And I thought, how cool is that? Okay. So she actually told me they do not recommend those. They would rather give you the test themselves. That way they can be there to support you and point you in the right direction. I think that's a lovely, blessing, wonderful thing right there. I think that's great, because they don't want you to be alone. And just like the rainbow, you're not allowed to be alone through all of this stuff. So I love you guys. Loree, make sure when you go back, you tell them I said again how much I love Piedmont Care, okay?
I sure will. I sure will.
Now, who should get tested and how often? I know who, every damn body, but how often?
Yeah, so I know that we've driven this home a lot in the last few minutes, but yes, per the CDC, everyone aged 13 to 64 should get tested at least once in their lifetime for HIV. For people who are sexually active, it's going to depend on the person, but for folks that are sexually active and depending on if they're on PrEP or if they're utilizing safer sex practices, I would recommend every 3 to 6 months. If you're on PrEP, a doctor should be following you, so they're going to most likely test you for HIV and STIs every 3 months, I think it is. But again, it depends on the person. But again, if you are sexually active and we're looking at 3 to 6 months, or maybe some folks like to do it just once a year. And if you're having any symptoms of anything, you immediately want to get tested. But yeah.
John said, I guess my other question is, I did some research for papers on HIV in older adults. What's happening here in South Carolina? I've discussed it with my father. At one point, there were not enough services or promotion campaigns.
I have a statistic sheet here, John. Hang tight with me just 1 second. I think that it addresses that on here. I thought that it did.
Pardon me.
I think, I apologize, John. I don't have the specific statistic that I was seeking and that I was referring and I wanted to give to you. But I think that it just kind of goes with, when you think about elderly or an older population, I think that people have a tendency to kind of look at them childlike and to treat them almost like they're children, and they do not honor and respect and celebrate that they still are having sex and that they are sexual creatures, and that, you know, oh, I'm too old for STIs, or I'm too old for this or that. I think that if it's something that you're worried about, that may be impacting your father, I believe he said, you can encourage him to get tested. Certainly he would need to get tested if he were sexually active. But again, I think, again, with the older people, I think that that's another pocket where education is lacking, just because people treat them like, you know, and I'm very, very guilty of this too. But I mean, just think about how many times you've seen like an old couple or something, an elderly couple, and you're like, oh, they're so cute. Like, you know, and I mean, now that I think about that, and I mean, you know, it's like, no, they're not children. I mean, they're they're grown
Right.
adults, you know, and they,
Right.
you know, are still, people are having robust sex lives, you know, as they get older, but we still need to think about all of the same things that anyone any age is having sex. What type of STIs are present? What is HIV like in my area? And the chart that Kim showed when we first started, I do have that statistic here. And this is consistent. This happens each year when I update this sheet. But South Carolina, or not specifically South Carolina, but all of the AIDS case rates are, where is that statistic? They're heavily concentrated in the South. And I believe, what was it, 52% was the one I was looking for.
Well, we found
Oh,
out
here
we
we go.
bumped it.
The South accounted for about half of all new AIDS diagnoses in 2017. So when we say the South,
Wow.
yeah, it's gonna, you're
Wow.
thinking, yeah. So we're
Wow.
in that. So if it's, again, if it's a person, regardless of their age, if they're sexually active, just think about the circumstances, think about the context and all of that, and we're going to be at an increased risk because of, you know, just where we live.
Right. And John, we found out, Mocha and I found out a couple hundred prides ago, which we didn't think about it because, you know, I'm only 27, right? So I never really thought about it. But our older LGBT people, they don't have support groups and stuff, okay? And they don't have people to talk to. And like you said, they don't have programs, okay? And we treat them like children. One lady came up to my table one year and she said, I see that there's a group for older men, but where is a group for older women? And I said, you can be a part of the rainbow, but I don't know what to tell you, because they do not have the support that the other LGBT2. We've found that to be true. So if there were sexual issues or whatever, they don't have a group to discuss it with. So I
Yeah.
like it that you're watching out for your dad though, John.
Mm-hmm.
Yeah. Okay, what is this PrEP shit, and what do people need to know about it? I told you we do shit here real on the rainbow. Okay, I'm not playing around. We do real stuff. That way people can really ask us and they won't care. The
Yeah.
rainbow has
Okay.
always functioned on that way. And that way you're like, oh no, Kim, she cool. She don't care. I don't care.
So I'm
I don't.
specifically looking at his question, the new versions of
Oh,
PrEP. So in the United States, I know that everyone's probably heard of Truvada for PrEP, and now there is another option that you may see the commercials for, which is Descovy for PrEP. That is only for men who have sex with men. So that's not for anyone who has a vulva or has a vagina, because it builds up in vaginal tissue differently than it does in rectal tissue. And I don't believe that it has been studied in that population. So PrEP, pre-exposure prophylaxis, Truvada for PrEP or Descovy for PrEP, is a pill that people can take once a day that reduces their risk of getting HIV through sex by over 90%. There is a way that it can be prescribed, which is I have actually just recently learned about. So normally you hear the dosing protocol is, you know, one pill per day, because that's going to keep or maintain the levels of it in your system. There is something called on-demand PrEP. I am not as well versed in that because I think that it's rare for it to be prescribed that way. So I'm a little hesitant to speak on that. But again, the way that I am familiar with it being prescribed is one pill per day. Any drug interactions, any hormones, if a person is transitioning, it is not known to interact with those. They will do bone density testing for folks that are taking PrEP, because I think that it can reduce bone density. But the thing about that is once the person stops taking PrEP, the bone density levels go back to normal. When you are on PrEP, you should have a doctor that is following you, as we talked about a few minutes ago, because they do want to make sure that you are not, excuse me, they want to check you for STIs and check you for HIV. I have gotten questions from some of my testing clients before that say, you know, hey, my friend's got some Truvada and I think I'm going to take it for, you know, whatever, and I'm going to do this and do that. That is not recommended. And the reason that is not recommended is because you want to be under that doctor's care. You want to be followed closely by a doctor, again, who knows what the heck they're doing and what they're talking about. If a person comes in, and again, they should be getting these blood draws and these regular testings, but if a person comes into Piedmont Care, that's one of the questions we ask. Are you on PrEP? The reason that we ask that is because if you are taking it and you are newly infected with HIV, it can make an HIV detection difficult to detect. That's getting a little more complex there, but we will ask you that because ideally you should be getting blood draws from your doctor.
Well, the Rainbow says that anyway. We won't counsel anybody or talk to anybody if you're on medication and you're not under a doctor's care. We want people to thrive and survive. So you have to, if you deal with the Rainbow, you've got to be under a doctor's care. If you don't have a doctor, we'll help you find one. However, you have to be under a doctor's care. Now, is this pill, just for those people that don't know, is it one pill a day while I'm having sex, or one pill a day for the rest of my life, or one pill a day for a season? What is that one pill a day?
It's one pill a day for as long as you want it to be. If it's going to be, you know, if that person, I guess it depends person to person. But one pill a day, some people, you know, I have had some testing clients to tell me that they were on it. Hey, I was in a relationship or a partnership where my partner was HIV positive and I took PrEP, and then we broke up and I'm not really wanting to date anyone. So I just went off of it. So, I mean, you know, that's just one scenario, but it just depends on the person. But if you are on it and you're sexually active and you want to maintain those levels, you definitely want to continue to take your PrEP one pill a day. Let's see, Tamika.
Now, you did say that this PrEP was expensive, though.
I'm not familiar with I can't quote you an exact number. I know that it is pricey, and I also know that there are wonderful assistance programs out there. One of those being Gilead, and I believe it's GileadAdvancingAccess.com. Gilead is the manufacturer of PrEP. So they should help you navigate the ins and outs of if that's something that you want to pursue. There's another, this is South Carolina specific. I believe it's called PrepMeSouthCarolina.org. That's a good resource. I actually just started following them on Instagram. They have an Instagram account, and I think that is a DHEC initiative to promote PrEP use. But I tell people if they want to be on PrEP, yes, absolutely. What he just said, I was told to consider PrEP like birth control. Yeah. So one pill a day, maintain those levels, keep it in your system. Absolutely. Yeah.
Okay. That does make sense, John. We like John.
I do like John. I'm going to start using
John's
that.
Cool. He's got right. John, you got some great questions there, dude. Okay, now this last question, I think it is about this right here, which I really wanted to talk about. Okay, we've talked about safe sex. We've talked about what Piedmont Care does for us. We've talked about the testing, how important it is. We've talked about PrEP. We've talked about all this stuff. But let's talk about it with COVID-19. Okay, that makes things a little different.
Yeah.
What does it look like with the COVID-19? Like, I don't know. Where do you, this stuff has such great stuff in it. Okay. So how does COVID-19 spread? Do you want to start with that one?
COVID-19 has thrown a wrench into everything, but like you said when we first began, I am thankful for the conversations that it has started, because I think that when the New York City Health Department put out the guide to safer sex in the time of COVID, and they came out swinging, and they were mentioning sex toys and rimming and, saying you are your safest sex partner. I just think that that opened a million doors, and I love it so much. If you've not seen that document, you need to look it up.
No, I loved it too. That's why I said I hope that we get to talk about this, because like I told you when we prepared for this video, that the rainbow, we talk about whatever, I don't care. I mean, maybe
Yeah.
we should have put a parental warning on this one, but I don't care. I did not know till you taught me, and I brought it back to the people. I did not know that rectal tissue was the thinnest tissue in our body. I did not know this. And I know I'm only 27, okay? But I didn't know this. And I'm like, why didn't I know that? And of all I've had babies, LOREE. Why didn't I know that? Okay. I think we're not talking enough about real shit. I think
Yeah.
that people are too embarrassed to talk about things. So Mocha and I talked about it and how serious we were about people getting sick still and stuff like that. That we're really focusing on the education of this stuff. So I don't care. I want you to talk about this stuff, and I don't care if you say rimming. Okay,
Okay.
rimming is good. Let's talk about rimming. Let's
Okay.
talk about what we need to have to talk about for education. And I
Okay.
told you, you are free to do so on the rainbow.
Okay. So, and I appreciate that. Because
Absolutely.
knowledge is power, and I can't sugarcoat some things. And when we're talking about, anatomy and sex and things like that, I have to be just straightforward. So when we say, when Kim say, talk about rimming, the reason that is so important to think about in the context of COVID is because COVID-19 has been detected in the feces of some people who are infected or who have been infected. So if you are participating in oral sex, specifically rimming, you are taking that chance that you may get some sort of fecal matter in your mouth, and then you may be infected by that way. Now, the flip side of that, I would like to state that we hear it called novel coronavirus because it is so new. So any of the information that I'm giving, if I'm neglecting any information, if there's, more information that comes out tomorrow that, yeah, this is an STI, we need to worry about this. I do not know that as of today, May 22nd or whatever. Is it a sexually transmitted infection that you can get it from the act of sex itself? No, it's not. It's spread through respiratory droplets. But if you are going to be in close contact with someone, then that definitely is going to put you at risk for spreading or for getting coronavirus. So if we encourage you to stay home. We encourage you to quarantine. If you are going to go out and have sex with someone who is, someone that you're not living with, someone that is not your partner, that you're under the same roof as, you're going to put yourself at risk for COVID. We want you to still use your safer sex practices, use your dental dams. If you don't have a dental dam, you can take a flavored condom and cut the top off of it and cut through it and open it up. Use your safer sex practices. So at the very least, we are going to keep you protected from HIV and STIs. I did mention this earlier when I was speaking to someone earlier this week, and this one really struck me. Dan Savage, who is a podcaster, he's talks about sexual issues and things like that. I'm a big fan of him. He said in an interview that I was listening to a few weeks ago that when he was a youth growing up in the 80s, in the time of HIV, in the time of this in that epidemic, that when he would go out and have indiscriminate condomless sex with people, that he was only putting himself at risk. And he gave this comparison. He said, and then I would go home and I lived with my parents, and I wasn't putting my parents at risk. I was only putting myself at risk. Now with coronavirus, if you say, I need to get laid, I'm going to go have sex with someone, I'm going outside the house, I'm going to use my condoms, and I'm not putting anyone at risk. Well, if you're meeting someone that you don't know, you are going to risk getting coronavirus. And then you're thinking you're coming home. If you're living with your mother, if you're living with your whoever you're living with, a roommate, you're going to put that person at risk. So number one, we want you to stay home. Think about what the New York City Safer Guide to Sex and during coronavirus said. You are your safest sex partner at this time. If you want to use sex toys, masturbate, just make sure that you are washing hands before and after. If you absolutely just do not listen to anything I say and you leave your house and you want to go and have sex with someone, again, just utilize your safer sex practices, but do keep in mind that you're not just putting yourself at risk, you're going to put everyone at risk that you come in contact with for COVID.
Right. The advice for people who have sex, who meet your sex partners online, or if you're making a living by having sex, it says consider taking a break right now.
Mm-hmm.
Maybe you can think of it as a sabbatical. Okay. And right now you're just not working because that 6-foot rule. Okay. You can't have sex within 6 foot. I mean, I want to see. I mean, that could be fun, but I mean, come on. But I like this. And I like this that it is actually a doctor form. There's masturbation on there. I think that's cool.
They said so many wonderful things, words that they said. It was just great.
I'm so proud of them. Right.
Them.
I'm so proud. I'm so proud. Good job, you guys. Good job. Yeah, because technically, now we were talking before we came on here. The world is being weird with this coronavirus. You could go in town A and they're acting like everything's fine, and town B, they're not. I still think everybody should be careful right now. I know that everybody's horny and wants to go out and have sex. I'm down for the masturbation, porno. I mean, Netflix has got to be making a fortune. Okay. I mean, there's ways around this right now, and I think our safety should be first. When it comes to the corona, then you pass that and you still got to be safe for the sex part. So everybody be sex. Take care during sex. Okay, did you want to talk about that part down there? Do you have this paper?
Is that
this number 3 part?
The New York
the kissing. One? Yeah, the kissing, the rimming, the dental dams. You want me to read these?
Yeah, I don't have that one in front of me. Can I apologize?
Okay, no, don't you apologize. Believe it or not, look at me being organized. How cool is that, right? It won't happen again. It won't ever happen again. No, this right here, it's cool. It says, take care during sex. Now remember, parental warning, okay? This is like real for real knowledge. This is education without bullshit, and I like that. Kissing can easily pass COVID-19. Of course, because it's within that 6 feet, but okay. Avoid kissing anyone who is not a part of your small circle. So right now, no kissing, I'm sorry. Rimming mouth on anus might spread COVID. And like she said, they found it in some patients that had COVID-19. So they're just saying right now that it can live within that. So avoid that altogether right now. Condoms and dental dams can reduce contact with saliva or feces, which is very important. And like we did last time, and I showed you the dental dams and stuff. Look, Laura, you'd be proud of me. Da, 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 da. And we show them and we tell them what they are so that we are no longer stupid people. We know our parents did not teach us right. So we'll teach each other. Okay. Washing up before and after sex is more important than ever. Wash your hands often with soap and water for at least 20 seconds and wash all your sex toys with soap and warm water. Disinfect keyboards and touchscreens that you share with others for video chatting or watching porn or for anything else. Don't you love how they put that in there? I love that.
Yeah, it was a very thorough list.
Absolutely. And no holes barred. I like that.
No.
And they said what they had to say. People are
Yeah.
always like, Kim, why are you so shocking? I don't care because I have things to tell you. I don't care if it ruffles your feathers. I don't care. Okay, number 4, skip sex if your partner is not feeling well. Well, first of all, that would be rude if your partner is not feeling well. Okay, we don't want to have sex with you then. But they could be sick, so, and you don't want to be kissing and stuff like that. We talked about all that. We talked about all that. And yes, okay, so we've covered all that. Okay, and yes, sex can exist, except it's a virtual sex. So yeah. So is there anything else? I think we have covered like a plethora of things. I
Yeah,
think we have covered. We have covered. If it has been STD or HIV related, we have covered it. Is
yeah.
there anything else that you can think of that we did not cover?
We talked about PrEP. We talked about COVID. We talked about safer sex, the importance of getting tested. One more thing. Yeah, I do want to add one more thing. If a
Okay.
person, and again, we haven't reinstated testing yet, but that is on the horizon, and we're working, to do that in the safest way possible. So when that does happen, beforehand, if there's some reason that you want to get tested and you're unable to get tested right now because of the virus, if you want to contact me via email or anything like that to talk about your risk factors or any concerns that you may have, I am open to that. So you can certainly do that, and I just want to throw that out there because I don't want.
No, and I want you to, because, and then what I want to tell the people is Loree's wicked cool. The ladies up there are wicked cool. And I don't want you to be afraid. And they do know about trans issues, and they do know about the LGBT, and they do really care. And they'll teach you shit you didn't even think you needed to know. I really think that everybody should take Loree up on it. If you're more in the Greenville area, 8 Upstate is there, but if you still want to come to Piedmont Care, you can. They'll answer the call. They'll talk to you. We've listed her telephone number down here. We've listed her .org down here. Find her because if you have any questions, and remember, if you have any questions, you want to contact us, you know how to get a hold of us. Rainbow Support Group sc.com. On there you can find the contact us link through there, and you can get to us there as well. We only have like 3 more minutes. Is there anything else you want to say? Do you guys want to say anything? I see we've been getting lots of questions, and we've been answering them as we go along. I love having David in the background. I want you to know that is my cheat. That is my kid. Isn't he great? He's amazing. He is. Look, he's amazing. He is amazing.
He's moderator. He's
everything. What isn't he, right? How many good thing we don't do badges. I'd have to buy like 20. He'd have to like go through them. Okay, right now I'm this. Okay, right now I'm this. But we're doing our thing. Well, Loree, I do want to thank you for coming and spending an hour with us.
Thank you for having me. I really do appreciate it. And for you giving me a platform to discuss issues that are so important, and giving people access to this kind of information that may not otherwise have access to it. So I truly do appreciate it.
My pleasure. And you'll be hearing from me within the next month, so that when Mocha and I do our live, I'll have some more information. So find more freaky information for me.
If I do, I'll send it your way.
Loree, thank you so much. Thank you for joining us. For everyone watching, thank you. We are so very grateful that you have dedicated this hour to joining us here at Rainbow Support Group. If you just happen to be coming in on the tail end of this video, it is going to remain up on our Facebook page. It's not going anywhere. And keep an eye on our Facebook. We are launching our brand new YouTube channel. So we're going to be making a playlist of all of our previous videos. So you'll be able to go back and get all this great information, through YouTube and Facebook and everywhere else.
So Loree, you're going to be on YouTube.
We are so grateful to have Loree with us tonight. Thank you, Loree. It's been very educational. I learned some stuff I didn't know. Kim learned some stuff.
Right?
The
Every
community
time.
learns stuff. Every time
Time.
we talk with Loree, we learn something new, and it's great.
We do. We do. We love Loree. We love
Thank
Loree.
you guys. I love you guys too.
All right. All right, David. I guess that's it.
All right, Loree, do you want to do the honors this time?
Yank it.
Okay, Loree, you want to do it? Yank it.
Yank
There
it.
you go, David. Yank it. Love you, Loree.